This is Think Out Loud on OPB. I'm Dave Miller. Oregon has reported 20 measles cases since the start of this year. Health officials say this could become the worst year in the state since the highly contagious disease was eradicated in the U.S. more than 25 years ago. Dean Sidelinger is the state epidemiologist. He joins us now. It's great to have you back on the show.
Thanks for having me.
I looked back at our calendar. We talked about measles outbreaks in June of 2025 and in August of 2024. What's different about this current outbreak?
I think, here we are just 3.5 months into the year, and we're reporting 20 cases. That's in comparison to just over 30 cases that we reported in 2024, which was our biggest year.
I mean, the year in total.
In total.
So, and we're only 3.5 months in, you're saying.
Right. And the cases we're seeing now are, many of them, we don't know where they came from. These aren't returning travelers who came and were exposed in another state or another country. We were able to make some connections between some cases, and we reported some linked cases last week. But for some of them, we don't know where they're coming from. And also, we know that in testing measles in the wastewater, which is a tool we weren't using a couple of years ago, we see counties that have measles detected in their wastewater where we don't have a report of a case. So we know that those 20 cases represent like the tip of the iceberg of what's actually happening. And so that's why we're talking about measles a lot, because we want people to know and know what the risk is.
I want to go back to the first part that you were leading with there, that you haven't been able to trace the origin of a lot of these cases. So, and am I right that that's, say, in contrast to a school-based outbreak, someplace where you can say there were these,
Correct.
In Texas or wherever, X number of cases, and no one wants to see a huge outbreak in some place, but you're saying it in some ways it's even more worrisome that there are these 20 cases and most of them have not, there's somehow somebody got measles, but you don't even exactly know how. And that's in its own way, it seems like that's a bigger problem.
Correct. It represents kind of some hidden spread. So people who have measles, for measles, it's one of the most contagious viruses we know, and people can spread the virus before they get too sick. So it's not like these are sick people who know they have measles and are out in our community, but people who maybe just started feeling sick and have some mild symptoms, and during that time they can expose others. It indicates that they're not going to seek care when they have measles, which is good, that they're not sick enough to seek care, but it's when they seek care that the provider reports it to us or a lab is obtained and it gets reported to us. So I think it's that kind of hidden spread that goes under the radar that we're worried about, and why we think these cases are going to increase pretty substantially and be with us for a while.
How does Oregon compare to other states right now in terms of case numbers?
I mean, luckily we're much lower than states like Utah and South Carolina, which have experienced and are experiencing some very large outbreaks. But I think it's well over 30 states have reported measles cases already this year. And while 20, again, doesn't seem like a lot, we know there are more, and that's higher than many other states. So that's why, we're talking to folks. And overall, I want to reassure people, if you're fully vaccinated against measles, your kids are fully vaccinated, you're very well protected. And so this year is not going to be much different to you than previous years. But if you are not vaccinated or have children who are not vaccinated, either because they're under 1 or you've chosen not to start their vaccines when they turn 1, or you're immunocompromised, like you're getting cancer, chemotherapy, or taking medications that cause your immune system not to work, there is a chance you could be exposed to measles and get sick this year, which is not something we said last year because we didn't see this spread.
Let's talk about what can happen when you get sick. The first measles-related hospitalization in Oregon this year was reported just a few days ago. How serious can measles be?
So I want to dispel the rumor that measles is just, a fever with a rash. Certainly, those are key characteristics. We start with kind of some runny nose, congestion, watery red eyes, and a fever. Shortly after the fever starts, or about the same time, we develop a rash, typically on our face, that travels downward. And even that makes people miserable. Children with measles are miserable. They feel awful. Adults feel awful. So it's not a great illness to have. And on top of that, it can infect the lungs, and we can get pneumonia. It can cause swelling and inflammation in the brain. And those often require hospitalizations. And so, hospitalizations are not that rare with measles. They're rare when measles is rare, but as the numbers go up, we expect to see more people hospitalized. And we don't have a treatment for measles. We have a great vaccine that works to prevent measles, but there's no treatment. So we can treat, the symptoms of the pneumonia. We can try and treat the inflammation, in the brain, but we can't treat the virus itself. And that's why, before we kind of eliminated this disease with the measles, mumps, and rubella shot, like 1 in 1,000 people died from this. And so that's also, a possibility. Last year in this country, we had 3 people die from measles, and that's tragic because in my mind, those deaths were preventable.
When you say, and I said it in my intro, this is, language that has been pretty common for 2.5 decades, that measles was eradicated in the U.S. What does that mean?
So, people hear that and they're like, but I hear about measles every now and again. What it means is that measles isn't regularly transmitting in this country, so that the cases we saw were sporadic. Typically were traced to someone returning from another country who had measles. They may have exposed people in their household or people in a healthcare setting or another setting where they were. And we can usually get a handle on that, hear who they're around, know those cases, have those people stay home who were exposed and not immune, and prevent the spread or limit the spread. That's what measles elimination means. And since the early 2000s, the United States has been in that situation where those measles kind of outbreaks happened occasionally. Some were a little larger than others, but we could get control of them. We've seen measles spreading, since early 2025, initially large outbreaks in Texas, many other states with outbreaks. And that spread has continued now for about 1.5 years in this country. And that's why we talk about measles. We'll likely lose our measles elimination status this year. I would say, if you just look at the spread and look at the cases and how they're reported each week, I think we're there.
Well,
but we have to analyze all the data, and the WHO will make that decision in the fall.
Right. It does seem like that's what you were saying earlier in terms of the spread already in Oregon this year.
Right.
If it's not tied to obvious outbreaks, that it seems almost by definition that it's endemic, or at least common enough even today in Oregon without a huge number of cases, that it's not eliminated in Oregon, and we're not the worst state.
Right. And I would feel comfortable saying that in Oregon, what we're seeing is that the disease is likely endemic for now, and that it's not eliminated. Again, the official word on the country losing elimination status and measles being endemic again, comes from us sharing the data with the WHO, them examining all the data and making a decision. Like I said, we expect those meetings and those discussions to happen in the fall, and likely we'll follow the same path Canada did last year when they lost their measles elimination status.
What's happening, speaking of the federal level, what is the messaging from the federal government right now about the MMR vaccine?
I think, we've been getting mixed messages, particularly from the political appointees in the federal government. I will say, it's not a secret that Secretary Kennedy for many years headed a charity, a not-for-profit, that expressed a lot of skepticism about vaccine and was responsible for a lot of the misinformation that we saw online. And so that was when he was in the private sector, but that kind of dialogue has continued. Recently he has said he supports MMR vaccine in children, but I think, those expressions of support are few and far between compared to the rhetoric we've heard throughout his career. We have some dedicated, public health professionals and partners at the CDC who continue to work and support states on our measles needs and answer our questions. But the workforce there, is much smaller and has been really impacted by the cuts at the federal government. We know that the ACIP committee, which met last year, expressed a lot of skepticism about vaccines, including MMR and how we monitor safety. And so that, I think, has spread out into the general public, where we're seeing more distrust and kind of questions about vaccines. And I will say, as a pediatrician, I've had so many conversations with parents. I support them. They should, if they have concerns, if they have questions, get those answered, bring them up with their provider, because they're making a decision for their child. But I can say unequivocally, in looking at the data, we've used the MMR vaccine for decades. It's been very well studied. It led to the elimination of measles in this country, which meant no one had to worry about getting measles, including parents of children under 1 who are not eligible to get vaccinated routinely. And now we've kind of lost that, and that safety is gone. And initially there was concern. Dr. Wakefield, his study linking MMR to autism, completely not a reputable study. Forged data, was retracted. He lost his license, but that started, this skepticism. And time again, large studies have shown that that link isn't there, but yet we still hear that from some of the members who were on the ACIP last year and from our secretary. And so it's hard to combat that. And I know in public health, we got to rebuild that trust.
Last year, and I think maybe we'll get the latest non-medical exemption data, but from May of 2025 is the latest I've seen. Close to 10%, a record of Oregon parents opted their kids out of some number of required vaccines. What specific message do you have for parents?
So I have a couple messages. So I will say the flip side of that number is 9 out of 10 parents have chosen to fully vaccinate their children with the safe and effective vaccines, many of that we've used for decades. That provides their kids protection against these diseases, and as a byproduct, also provides protection to all of us in the community. So it's not a trade-off. So that's great, I think, because sometimes if you read things online or follow social media, you may think, well, no one's vaccinating their kids anymore. And I want to say that I thank and appreciate the 9 out of 10 people who've had those conversations with their providers and vaccinate their kids. I also want to say, for a parent who's concerned or has questions about vaccines, that's normal. And, talk to your child's trusted healthcare provider. Look at the American Academy of Pediatrics website, look at the OHA website, and follow some trusted links that describe vaccines and the ongoing monitoring and safety that happens. And also for parents who maybe were still concerned and chose not to vaccinate their children, the situation in 2026 is very different than it was in 2025 or 3 years ago or 4 years ago. Measles is going to become more common in Oregon, as it already has in other states. And so the decision you made 5 years ago for your child might be different this year because the risk of measles is so much higher, whereas the risk of measles wasn't as high 5 years ago. So, a safe vaccine that provides lifelong protection is available, and your decision might change based on the situation we're facing right now.
Dean Sidelinger, thanks very much.
Thank you.
Dean Sidelinger is a health officer and state epidemiologist for the Oregon Health Authority.